Colic treatment is really an intestinal problem, and it's been kind of promoted as a stomach problem. And so the end of the small intestine is called the ileum, the end of the large intestine is called the cecum. So there's a muscle right here called the ileocecal valve. It's a muscle. This muscle obviously gets weak because what's happening is as the digestion goes on in the small intestine, which the small intestine in adults is about 24 feet long. So it comes off the stomach and goes around and around and around and around where most of the digestion occurs. Then it connects over on the right side to the large intestine where it has to pass through this muscle. Now when it passes through, this muscle is supposed to close off so that it doesn't go back into the small intestine and try to be redigested. But on a muscle that's weak, that's obviously what's happening. So as it's leaking and it tries to get back the opposite direction, it redigests what's already been digested, and the end result is severe bloating of the small intestine. So if you treat the stomach when it's an intestinal problem, you're not going to be too successful. And that's one of the problems with medicine for this type of problem, is that millicon and different types of chemicals, they're trying to stop the bloating and the bubbling in the stomach when it really is an intestinal issue. So it hasn't been very effective, and I would say 90% of the babies that came in here have already been on those types of treatment, and it didn't work. What we do in colic is I just use a little muscle technique that I strengthen that little muscle. And when that muscle gets strong, colic goes away. And it takes me approximately 2 weeks. And the patient will usually see about a 20 to 30% improvement after the first visit. I try to see that maybe daily for maybe a couple of weeks. And the success of this, if it's a colic problem, I find that it works at 100% of the time.